Hi, this is Courtney with PRMA Plastic Surgery. Continuing on our support spotlight, we are joined today by the local Susan G. Komen organization in the San Antonio area. So thank you so much for joining us today. And to get things started, can you give us kind of a brief overview of how Susan G. Komen got started?
Yeah, absolutely. I'm so happy to be with you here, Courtney. I know it's a crazy time for everyone, but being able to share all of the great things that are happening in the community and with what you guys are doing for your patients is definitely inspiring. But my name is Elise Bernal. I'm the executive director at Susan G. Komen San Antonio. We were started, our local affiliate, in 1997 by a group of local survivors who lived in the community and recognized that there was great need in our city and county in terms of more support and education, especially with our high uninsured population. So they applied to the national headquarters of Susan G. Komen to bring a local affiliate here and start our very first Race for the Cure in '97. And we've been around since then, over 22 years, with money that we raise staying in the local community and going towards services that help the uninsured get access to care, including the very important screening and treatment assistance.
That's amazing. Can you go into more detail about the Komen Walk and how it has transitioned over the years to meet the needs of the local community?
Absolutely. So a lot of folks recognize this for our signature Race for the Cure event, which has been happening for over 20 years. And this year, it was supposed to be this Saturday on May the 9th, where we were going to unveil our inaugural More Than Pink Walk. We actually have moved that to September the 26th to make sure that there's enough time to make it a safer event, and when things kind of die down a little bit with infection rates and that kind of thing. But one of the exciting things that is to come with these new More Than Pink walks is that you will see and be able to experience more of the work that you're funding when you participate in a More Than Pink walk. So we have always been known for research or screening. A lot of folks don't realize that we're actually involved in public policy and advocacy work, that we do our own community profile in the county, where we look at the most vulnerable zip codes in our city to determine where our care needs to be concentrated the most. And so we have distilled our mission down into 4 key pillars, which is research, community, care, and action. You will see an area specific to each of those pillars at the walk, where you will learn more about we're funding research that is looking at the deadliest types of breast cancers. You'll learn a little bit more about the laws that we were able to pass during the last Texas legislative session. You'll learn about the screening and the number of rides that folks have provided and enabled us to provide to folks who don't have cars with their support of the walk. So we're really excited just to show folks and engage them in a different way, get them more closely connected to the work that they're funding at the walk. The races have been wonderful and they were great. They're competitive, it's in the name, Race for the Cure. And in changing to a More Than Pink walk, we are symbolizing that we walk together, that we'll finish together, and that we are standing side by side each other in support of folks who are going through this disease. So we're really excited about it and what that's going to look like in the fall.
I'm really excited too, and I'm so sad that the walk got postponed, but I'm really excited that you guys are still going to do it this year because we were really looking forward to being a part of that.
Yeah.
Can you break down a little bit for me how you guys help the local breast cancer community, specifically for women in need? What kind of services do you offer them?
Yes, absolutely. So we're actually, we have a national helpline that folks can call, 1-877-GO-KOMEN, for any questions related to care. We have a localized treatment assistance program where folks who have breast cancer now, who have a diagnosis and are in need, can get direct access to a limited financial grant to help them with food, with gas, transportation, or medical supplies. We also have programs right now. Our programs that we're helping for preventative screening mammograms have kind of been put on pause from recommendations from the medical community, so as not to expose folks to a healthcare system that is a little bit overburdened right now. But we still have programs that can help with the diagnostic testing. So if you do have lumps or something that is concerning, we want folks to know you don't have to stay home just because of the pandemic. There are programs that can help you get diagnostic testing. We still have programs that are able to help with transportation. So it's kind of, we run the whole gamut of program and support services for folks who have either been diagnosed or are trying to make sure that they don't have breast cancer, and even the aftercare. Folks still need wigs and scarves, and we have programs that can help with that.
Yeah, we love that you have that support for those women, especially because, the need was there before,
right.
And now with a lot of the financial hardship that's going to come from the coronavirus, this is going to be even, more of a need and a more highlighted, area of support that you guys can offer the local community.
Yeah. Unfortunately,
thank you so much.
Oh yeah, of course. No, I was just gonna say that unfortunately the need is getting greater. You're right. Our community had a lot of need before this, with the rising number of unemployed and folks losing in their insurance status. These programs are more important now than ever. But I have to say thank you to PRMA, because you guys have participated this year in the walk as a sponsor and have been such an incredible partner to us to help patients and survivors get the resources that they need. So we really appreciate and thank you guys for that, because we can't do this work alone, and y'all have been a fabulous partner in this fight.
Oh, absolutely. And it's our honor and our absolute pleasure to do so. And we thank you so much for spending some time chatting with us today, so we can spread the word about everything the local Susan G. Komen chapter is doing for our breast cancer and reconstruction community. So thanks so much, and we'll talk again soon.
It's good to see you.